It's amazing. You live with something, a little bit of pain or something, and you think, oh, that's normal because you're getting older. This wasn't normal. My name's Greg Szymanski. I'm 73 years old. I live in McWanago, Wisconsin. My wife and I have lived there for 38 years now. We have a small business. I'm planning actually right now, planning on retirement in the next 6 months.
Greg was referred to us by his primary care physician who had heard a murmur, which is an abnormal sound, and he found that his aortic valve, which should have been this size, which is 4 centimeters square, was less than 1 centimeter square.
Where the aortic valve is the valve that keeps blood going forward and prevents it from going backwards into the heart. As people get older over time, that valve can get too tight, it gets calcified, and then the heart has to pump against resistance, and that's aortic stenosis. Patients generally feel symptoms, and the symptoms are usually shortness of breath, fatigue, sometimes dizziness or lightheadedness, and that's just simply because the heart's working too hard against that resistance.
So up until 8 to 10 years ago, for patients with aortic stenosis, the traditional treatment was heart surgery. But nowadays, after multiple scientific trials, we have now developed our minimally invasive aortic valve surgery. It is less invasive. Patients go home within 2 to 3 days, and it is applicable to all risk patients.
Given that he was a good candidate for the trial, we approached him and asked him if he would be willing to participate in the procedure, and he opted to be a part of the trial.
Through participation in clinical trials, Aurora St. Luke's Medical Center has truly been a leader in minimally invasive transcatheter valve replacement procedures that don't require open heart surgery. We do research in a number of clinical areas. Our most focused areas include oncology, cardiovascular, and neurosciences. We have physicians working side by side with scientists from bench to bedside to work on relevant clinical problems that address patient needs and improved outcomes. Our research is supported by a number of different internal resources, such as a human tissue biorepository, discovery laboratory, neuroanatomy laboratory, data analytics center of excellence, and the Ed House Center for Healthcare Transformation. Together with all of these resources, we're really able to tackle tough clinical questions and focus on improving patient outcomes. It really takes people like Greg and the thousands of clinical trial participants who engage with us every year to bring new innovations to healthcare and to help us move research forward.
I would recommend to anybody that has been asked to be involved with a study, think about it seriously. You may find that it will be the answer to everything that you need to have to live a normal and complete life.